only. So one of the most popular topics, if I start from the first chapter, would be, you have to know erythropoiesis steps, leukopoiesis steps, right? These are important questions. Then in erythropoiesis specifically, it is asked about erythropoietin. So I've given you 2 or 3 questions about erythropoietin. Then also they like to ask that the hemoglobin is appearing for the first time in which stage, right? That is also commonly asked. So these are some important questions. Then leukopoiesis also the same. You have to know the different granulocyte stages and agranulocyte, both of them. And after that, in immunity, you should be knowing cell mediated and humoral immunity. Jaundice is done in biochemistry in detail. And finally, you need to know about the major histocompatibility complexes 1 and 2, including CD4 and CD8 cells, right? Cytotoxic cells and helper cells. And lastly, you definitely should know the types of immunoglobulins, right? So A, G, M, D, and E, right? These are some short notes which are important. Let's start with the first question now, right? So very good evening. List below are the hydrostatic and oncotic pressures within a microcirculatory bed. So plasma colloid osmotic pressure is given, capillary hydrostatic pressure is given. Let me make a quick picture of capillary for you so that you are on the right direction here and can give me the answer straight away. So this is a picture of my tissue capillary, right? This is the picture of my tissue capillary. Now please look at the directions once more. Most of you should be knowing about it. We have the hydrostatic pressure in the capillary. Remember, it is a pushing pressure. It is pushing the fluid out. What is the value? I have given you 25, right? So I'll write 25 over here. Then we have the oncotic pressure in the capillary, which is trying to pull the fluid back. Again, what value is given? 25, right? Millimeter mercury are all the values. Then I have the venous hydrostatic pressure, arterial pressure, I don't require it, remember. And then we have something known as the interstitial fluid hydrostatic pressure, right? And interstitial colloid oncotic pressure. So if you could recap, interstitial fluid oncotic pressure is again try to pull the fluid out, right? What is the value given? 10. So these two are acting in the same direction. And then I have given you the interstitial fluid hydrostatic pressure. This is very interesting. Normally, remember, this is written like this, PIF, right? But the problem is here I have given you the value -5. Now -5 means it is actually not pushing the fluid back in, but rather it is, yes, what is it doing? It is acting in reverse direction. So let's find out the net filtration pressure. Net filtration pressure, right? What should be the answer? The answer would be yes, which two are acting in the same direction? Hydrostatic in the capillary plus oncotic in the interstitial minus oncotic in the capillary minus hydrostatic and interstitial. Now let's do a simple mathematics. Answer would be yes, you are right. Daily says yes, daily is world, you are right, absolutely correct. 25 plus 10 minus 25 minus -5. That's a very important thing, and you have given me the correct answer. It is 15 millimeters of mercury. But the problem is I am not asking you here the net filtration pressure, although I have given you one choice of 15, which some students make mistake. I have given you the capillary filtration rate, which is none but equal to Kf, which is the filtration coefficient, into NFP. And now you can easily tell me the Kf would be equal to 150 upon the NFP. That means 150 upon 15. So the answer would be yes, 10 and not 15, right? That was the only thing you had to do. Yes, absolutely correct. It is 10 because I have to divide 150, which is capillary filtration rate, is nothing but what is Kf? Filtration coefficient, capillary filtration coefficient. If you could recap, what is that product of? Yes, total surface area into Yes, permeability of the capillaries. Absolutely right. Yes, Daly's world, you're right. Let's move on to second one. Which statement is true concerning erythroblastosis fetalis? Remember, erythroblastosis fetalis or hemolytic disease of newborn, HDN. This is a very important short note for your exam. 100% question comes in the terminal exams or the professional exams out of this. You have to know this each and everything. First of all, is the first statement true or false? Think about it. Rh positive mother, yes, has an Rh negative child. No, it is vice versa. When the Rh negative mother will have Rh positive child, right? So this is false. Hemolytic disease of newborn is prevented by giving mother a blood transfusion. No. I will not give her a blood transfusion. I give her something known as the anti-D, or also known as ROGAM. Anti-D or ROGAM. Right? It is given to such mothers to prevent the sensitization of the mother with the previous exposure to Rh positive antigens. Right? So we are not giving blood transfusion, but we are giving anti-D. So this is also false. Then a complete blood transfusion is after the first birth will prevent hemolytic disease of newborn. Again, I told you a complete blood transfusion after the first birth will not prevent hemolytic disease of newborn, because after the first birth I need to make sure that the mother has been exposed to Rh positive antigen. So I will do something known as direct and indirect Coombs test to find out whether the mother has the antibodies, and we never give blood transfusion. It will not, prevent hemolytic disease of newborn. So this is also false. Now coming to which one is correct. Actually, this is right. The father of the child must be Rh positive, because remember, the Rh allele is capital D. Either it is double D or it is like this, heterozygous versus homozygous, right? But it can never be this, right? So that is why we say the father has to be Rh positive, right? Yes, Daly's world, what answer you are saying? Triple B is right. Triple B means yes. Then moving on to question 3. What RBC enzyme facilitates the transport of carbon dioxide? That's an easy one. You should be able to tell me immediately. Yes, we will be doing it in respiratory system in detail. Inside the RBC, the following reaction occurs. CO2 combines with the H2O in the presence Okay, thank you. I am Dr. Kamal Jindal. Yes, I am Dr. Kamal Jindal. I am a physiology faculty, right? Yes. Dr. Gaurav Teri is a pathologist. So they combine in the presence of carbonic anhydrase. But doesn't matter, you can attend the session. It will be useful for you as well. Carbonic anhydrase. So this is the answer. As it reacts, it will form H2CO3, right? H2CO3. Right? So the reaction which is triggered inside the RBC is due to carbonic anhydrase. Moving on to question 4. A patient presents with hemoglobin of 7.9 gram per deciliter, so naturally having anemia. Hematocrit is normally 45%, that is also less, but MCV is nearly normal, right? It is normal. 90 femtoliter is normally normal, 80 to 90 is normal. Erythropoietin level is low. So very interesting question. Hemoglobin is less, hematocrit is less, mean corpuscular volume is normal, erythropoietin is quite low, right? So what could be the only possible answer? Remember, in sickle cell anemia and pernicious anemia, right, and in chronic blood loss, there will be decrease in hemoglobin. Hematocrit will also be less, but there would be increase in erythropoietin. Also in chronic blood loss such as hemorrhage, erythropoietin will increase. But in end stage renal disease, which is the answer here, why it is the answer? Because kidneys are doing a very important reaction. In kidneys, we synthesize erythropoietin. So erythropoietin is released by interstitial cells erythropoietin is released by interstitial cells in the peritubular capillary beds of the kidney. So remember, surrounding the capillaries we have the peritubular cells. So from the peritubular capillary beds there are interstitial cells. 85% of erythropoietin, yes, that's right, dialysis word. So what we say is that 85% of erythropoietin is by interstitial cells in peritubular capillary beds. Now it is a very common problem in chronic kidney disease patient whom we are calling end stage renal disease. End stage renal disease means these patients are having chronic kidney disease, which we also call in short as CKD. So in chronic kidney disease, which is CKD, these patients naturally will be having kidney damage, so they will have less erythropoietin, resulting in less hemoglobin, resulting in less hematocrit, right? So here the best answer was end stage renal disease, because याद रखिए बाकी सब में erythropoietin level increase होगा, but end stage renal disease में main cause of decrease in hemoglobin और hematocrit क्या है? Less erythropoietin, right? That was an important thing, and you should definitely know 85% of erythropoietin is via interstitial cells in peritubular capillary beds of kidney. Remaining 15% is perivenous hepatocytes. Perivenous hepatocytes. Moving on to question number. When red blood cells break down, the porphyrin product of hemoglobin is converted by macrophages to what product? That's an easy one. Remember, the hemoglobin has the porphyrin rings. They are broken down by the enzyme heme oxygenase, then ultimately biliverdin reductase, and eventually I am going to produce bilirubin. So my only correct answer here is bilirubin, right? Globin chain breakdown will produce the amino acids, right? Moving on to 7th one, that was a tricky question. How many oxygen atoms can be transported by each hemoglobin molecule? Atoms. Remember, a lot of people immediately mark the answer 4. 4 नहीं है, देखिए, because हीमोग्लोबिन में होता है अल्फा 2 बीटा 2, है ना, अल्फा 2 बीटा 2. ये है आपका एडल्ट हीमोग्लोबिन. Adult hemoglobin, which is alpha 2 beta 2, there is the iron which is present in ferrous form in the heme, right? And we know that the iron is binding to, so in the hemoglobin we have the ferrous in the heme form, which binds to 4 oxygen molecules. But over here I am asking you how many atoms, so naturally answer हो जाएगा 4 into 2, right? 4 into 2 atoms. So answer atoms है, because adult hemoglobin alpha 2 beta 2 globin chains, right? Then we have the 4 hemes. Each heme has the ferrous. Heme binds to how many oxygen? 1 oxygen. 4 heme, 4 oxygen molecule, but total 8 atoms. Moving to question 8. 74-year-old man has a hemoglobin of 6 gram per deciliter, hematocrit of 19, MCV of 117 femtoliter, and large bizarrely shaped erythrocytes. Serum folic acids are normal. This is a classical picture of macrocytic anemia. Now you should be knowing macrocytic anemia, it should be on your tips. Macrocytic anemia, when I talk about, remember, macrocytic anemia can occur due to 2 causes, either the B12 deficiency or folic acid deficiency, right? So both these conditions will cause large size RBCs, more than 100 femtoliters, known as macrocytes. The problem here is serum folic acids are normal. This I have given you already in the question. So the only correct answer is that there is now B12 deficiency. But straight away I am not giving you B12. I am asking you indirectly that we require something known as the intrinsic factor, which is produced by parietal cells, which is useful for B12 absorption, right? So what happens here is, in the pernicious anemia, when we have autoantibodies to parietal cells, intrinsic factor will decrease, resulting in B12 deficiency. I hope all of you got it. So the answer was insufficient intrinsic factor. Remember, in GIT we will be studying parietal cells also produce, yes, can you tell me the answer? HCl, right? Remember that. So parietal cells also produce HCl. Yes, A is the correct answer. That's right. During the second trimester of pregnancy, what is the predominant site of RBC production in the embryo, right? During the second trimester of pregnancy, what is the predominant site of RBC production? So generally we say yolk sac, is in the first 3 weeks. From third month onwards, it is the liver which is the main site. And after birth the bone marrow will take over, but what happens is the bone marrow of mainly the membranous bones such as your vertebrae, ribs and the sternum, right? So here yolk sac in the first 3 weeks, as we say, 3 weeks to 3 months, and then liver third month onwards, right? Okay, let's move to question number 10. What function do vitamin B12 and folic acid perform that is critical to hematopoiesis? Yes, interesting one. Remember, B12 and folic acid are acting like cofactors, or they are required for the TPP, which is known as thymidine pyrophosphate or thymidine triphosphate. So this reaction, it supports the production of thymidine triphosphate or thymidine pyrophosphate, which is required for the DNA synthesis, right? So if the DNA synthesis is lacking, what is going to happen? The cells will become very large in shape, right? Very large in shape. Moving to question number 11. This is a very good question. A 38-year-old healthy woman comes to you for routine visit. She has spent the past 2 months. So she has spent the past 2 months, by which we say, So she has spent the past 2 months. So this lady, she has spent the past 2 months Yes, just a second. Yes, so she has spent the past 2 months hiking through the Himalayas and climbed to the base camp of Mount Everest. What results would you expect to see on her complete blood count? CBC होता है complete blood count. So very interesting question. What will be seen in the complete blood count? ठीक है, ध्यान से देखिए question. इसमें 2 लॉजिक हैं. When the person goes to high altitude and is living there, high altitude पे such as Mount Everest, the main interesting thing which you need to know is atmospheric pressure is less. Atmosphere का pressure कम होता है, जिसकी वजह से there is decrease in partial pressure of oxygen. ठीक, this is famously known as hypoxia. Hypoxia is decrease in arterial O2. जैसे ही हाइपोक्सिया होगा, ऑक्सीजन विल बी लेस. हाइपोक्सिया इज द स्टिमुलस फॉर द रिलीज ऑफ एरिथ्रोपोएटिन. एरिथ्रोपोएटिन रिलीज होगा. एरिथ्रोपोएटिन विल बी द कॉज फॉर इंक्रीज आरबीसी काउंट। ठीक, इंक्रीज आरबीसी काउंट। अब देखिए क्वेश्चन में क्या क्या दिया हुआ है। आरबीसी काउंट बढ़ेगा तो नेचुरली हेमाटोक्रिट HCT विल ऑल्सो इंक्रीज। ठीक, बट द प्रॉब्लम इज क्वेश्चन में हेमाटोक्रिट बढ़ेगा, दैट्स राइट, आरबीसी काउंट भी इंक्रीज होगा, बट प्लीज अंडरस्टैंड WBC count or mean corpuscular volume को there would be no effect, because remember MCV will be normal, size of RBC will not be affected, और WBC count क्यों बढ़ेगा? There is no infection, right? This is not affected. So the correct answer was option number C. RBC count will increase due to hypoxia, erythropoietin is increasing, which is increasing RBC count and hematocrit, right? Moving to question 12, after a person is placed in an atmosphere with low oxygen, how long does it take for the increased number of reticulocytes to develop? So generally हम बोलते हैं कि it takes around 12 hours for the erythropoietin level to peak, and it takes around 3 days for the reticulocytes to develop, and 3 days लगता है reticulocytes को develop होने में, and 5 days it occurs for the RBCs to appear in circulation. So I can ask you another question कि after exposure to hypoxia या atmosphere with low oxygen, within how many days the new RBCs appear in circulation? तो उसका आंसर रहेगा 5 days, but within how many days reticulocytes develop? 3 days. Reason ये है कि reticulocytes से RBC बनने में it takes around 24 hours, right, to 48 hours. That is the reason we say it takes 5 days, right? Moving to question 13. Hemoglobin appears for the first time. ये सब वेरी इंपॉर्टेंट MCQ है फर्स्ट ईयर के हिसाब से, डेफिनेटली पूछ सकते हैं एग्जाम में, आपके प्रोफेशनल एग्जाम्स में, लाइक hemoglobin appears for the first time in which stage? So there is some controversy in various books, but regarding best answer is always intermediate erythroblast, which is clearly given in the Guyton textbook of physiology, right? So intermediate erythroblast is the best answer, but remember now the research articles are telling us, and there is an evidence that even in pro-normoblast or pro-erythroblast, early erythroblast also, the hemoglobin is or can be seen. But the problem is it is distinguishable, or I can see it clearly, visibly for the first time. Best answer is intermediate, right? So I can say अगर यहाँ पे appear होता है, early में appear होता है, तो यहाँ पे ज़्यादा है, it is better visible, right? That is why we are saying intermediate erythroblast is the best answer. Fine. Moving to question 14, which phagocytes can extrude digestion products and continue to survive and function for many months? So please याद रखिए, neutrophils cannot survive for months, they can only survive for few days, right? And basophils have the main role in allergic reactions, as you know, and eosinophils have basophils eosinophils have a role in parasitic infestation and allergies. So parasites जो इसमें हैं वो आपका eosinophil है, neutrophil और macrophage, but only the macrophages can go into tissues and they keep on surviving for months. So they migrate to tissues and these can survive for months, right? They can survive for months. Question 15. What cells ingest foreign material and microorganisms within the sinusoids of the liver? Now देखिए, same question I am changing for you. Basically I am asking you which are the macrophages which migrate to the liver and live there and acting like phagocytic cells. So कौन से होते हैं? Dendritic cells wrong answer है. Dendritic cells are APCs. APCs का मीनिंग होता है antigen presenting cells. मेगाकार्योसाइट्स, so everybody knows platelets है ना. So answer is none other than Kupffer cells. Kupffer cells जो होते हैं, they are specific macrophages which are the macrophages in the liver or hepatic sinusoids. Yes, that is the correct answer. Moving on to question 16. A 45-year-old man presents to the emergency department with a 2-week history of diarrhea that gets progressively worse during the past several days. He has minimal urine output, admitted to the hospital for dehydration. Naturally diarrhea होगा तो he will be passing loose stools, so he will have dehydration. Stool specimen is positive for parasitic eggs. what type of WBC would have an elevated number? देखिए clinical question है, commonly exam में पूछते हैं, they ask you such questions in exam. Answer is very easy. Basically stool is positive for parasites. So which are the cells which are elevated in parasitic infections or infestations? I think all of you know the answer. Yes, what should be the answer? Only and only eosinophils. Eosinophils normally are very less in percent, hardly we see 2 to 3 per 100 cells, but we say eosinophils number increase in parasitic parasitic infections or infestations. Moving to question 17, 62-year-old man who was known to have a normal blood cell count. न्यूट्रोफिल तो नहीं होगा आंसर डॉक्टर भोमराज बिश्नोई. न्यूट्रोफिल इंक्रीजेज मेनली इन बैक्टीरियल. ठीक है, ये पैरासिटिक है, लार्वा जो आप पढ़ के आए हैं क्लास 11-12. 62-year-old man who has known to have a normal blood count. This is a very interesting question now. Just see. Normal blood count है, differential count 3 months ago हुआ. कितने दिन पहले? सिर्फ 3 महीना पहले. He presents with pallor, bone pain, bruising, WBC count of 42,000. ठीक, so pallor है, right? Pallor, you know, yes, bone pain. 85% of the cells in circulation appear to be immature granulocytes. What is the diagnosis? बताइए सोच के. Very interesting question. 85% cells are immature granulocytes. This should give you the answer. मतलब very high number of immature granulocytes. This happens in only one condition, leukemia. ठीक, अब is it lymphocytic or myelocytic? Naturally it is myelocytic. Myelocytic are the granulocytes. Yes, but now it is not chronic, Uttam. It is not chronic. Chronic is more than at least 6 months duration. This is only 3 months. 3 months ago he had normal blood count. ठीक है, तो this is acute. इसीलिए आंसर chronic नहीं है. Chronic will be at least more than 6 months to 1 year. So here the answer is acute myelocytic leukemia. ठीक है, but at least you are on the right direction, Uttam. That is fine. आपने सही सोचा. आंसर रहेगा माइलोसिटिक नॉट लिम्फोसिटिक, बिकॉज टी लिम्फोसाइट्स का प्रॉब्लम नहीं है, बट द प्रॉब्लम इज इट इज ओनली 3 months में हो गया. 3 months पहले एवरीथिंग वाज नॉर्मल, राइट. 18. With what cell type can interact with IgE? What cell type can interact with IgE and release large amounts of histamine, bradykinin, serotonin, heparin, lysosomal enzymes, and other inflammatory mediators? This you all should be able to tell me. I was telling you just in the earlier part of this class today that immunoglobulins, all the types and their structure, variable region, hypervariable region should be well known to you all, right? It comes as a very common question in exam. Draw karna bhi aana chahiye. Yes, the only one correct answer. Who interacts with IgE to release large amount of histamine, bradykinin, and causing all allergic, reactions such as redness, increased capillary permeability. Yes, now you are right. Basophils and mast cells. Absolutely correct. Most potent stimulus for release of erythropoietin. 100% question will be asked to you in the Viva or in the MCQ exam, right? As a part of MCQ. Most potent stimulus. Please remember, hypercapnia is absolutely wrong answer. It has nothing to do with the erythropoietin release. Hypoxia is the correct answer. Cobalt salts are also right. Androgens, testosterone also stimulates erythropoiesis. That is why we males have higher RBC count than females. Estrogen inhibits erythropoiesis. By inhibiting erythropoietin, testosterone stimulates erythropoietin. But यहाँ पे best answer is hypoxia. Always remember, decrease in arterial O2. When the arterial O2 becomes less than 60 millimeter mercury, this is the most potent. ठीक है, ये दोनों भी stimulate करते हैं, but I am asking you most potent. Already I have discussed in previous question, 85% of erythropoietin in adults is released from interstitial cells in peritubular capillary beds of kidney, 15% perivenous hepatocytes. Must know, clearly mentioned in standard book Genong. Fluid exudation into the tissue in an acute inflammatory reaction is due to which of the following? Fluid exudation means that fluid is coming out from the capillaries into the tissues. So why does that happen? Remember, whenever there is inflammatory reaction, there is increased fluid movement. Fluid is moving out of the capillaries into the tissues. ठीक? But what is the reason? Reason is nothing to do. Why will the lymph vessels be obstructed? This is wrong. Lymph is working fine. Blood pressure is also not decreasing much. Decreased protein in interstitium? No. The main reason is inflammation causes increase in permeability of the capillaries. Yes, absolutely right. That is the correct answer, Uttam. Good. Moving to 21. Which cell type migrates into inflammatory sites to clean up the necrotic tissue and direct tissue remodeling? Now understand, neutrophils cannot survive for months. They can only ingest 5 to 20 bacteria, we say, or the infection agents. They can survive only for days, 5 to 10 days, not more than that. Macrophages, dendritic cell, I've already told you, are APCs, antigen presenting cells. Eosinophils again are involved in parasitic infections. They also cannot survive for more than few days. Survive for. So remember, macrophages are the cells which, interestingly, see this now, they can ingest 100 microbes, 100 to 200 microbes, that means a lot of microbes they can ingest, and they also survive for months. They also produce, macrophages, they produce cytokines. Cytokines can cause stimulation of fibroblast, thereby causing tissue remodeling, right? Tissue remodeling. So basically what we are saying is the macrophages are the one which is responsible for the ingesting hundreds of microbes. They can survive for months and they produce various cytokines which stimulate fibroblast and causes the tissue remodeling or the fibrosis which happens after the tissue damage, right? So macrophages, remember, can survive for months. Moving to question number 22, another important one, very interesting question. I will not say tough, you just have to use a little logic. A 3-year-old child who has had frequent ear infections is found to have reduced immunoglobulin levels and is unresponsive to vaccination with tetanus toxoid. However, the child has normal skin test reactivity, which is known as delayed redness and induration to a common environmental antigen. Which cell lineage is not functioning normally? So I will give you time to think about it. Very interesting question. Just read up once more with me. Yes. Reduced immunoglobulin levels, unresponsive to vaccination with tetanus toxoid. Remember, vaccination ka basic principle, there is a primary immune response, there is a secondary immune response. So when we give vaccination with a dead bacteria or attenuated bacteria, when the person has infection actually occurring, there will be something known as secondary immune response, where there are memory B cells which are able to produce lots and lots of immunoglobulin. Yahan pe immunoglobulin is not being produced, right? Now what happens is that what you are seeing here is that child has normal skin test reactivity. Normal skin test reactivity is actually occurring due to delayed redness and induration. this has the role of T cells. This requires helper and cytotoxic T cells. So this is, mind you all, normal. Everything is working normally. Yes, absolutely correct, Boomraj. That's, you should write. Absolutely correct. Just let me plug the device. Yes. Sorry about that. I need to plug the device. Sorry. Yeah. So you are absolutely correct. Macrophages are phagocytes. It has no role here. This is also incorrect. So I think you got the logic. B cells will form the plasma cell. Absolutely right. Who said that? Bhumraj. Yes, correct. And they will now form immunoglobulins. So basically यहाँ पे immunoglobulin नहीं बन रहा है, तो there is a B cell problem, not the T cell problem. ठीक. Moving to 23, very good. What is the term for binding of IgG and complement to an invading microbe to facilitate recognition? So basically देखिए what happens is, if this is a microbe, तो microbe पे bind करता है आपका immunoglobulin और आके बाइंड करता है समथिंग नोन एज कॉम्प्लीमेंट. व्हेन बोथ ऑफ दीज बाइंड टू द माइक्रोब्स, राइट, दिस फैसिलिटेट्स द easier recognition by the cells. So जो phagocytes हैं who are going to ingest these microbes, now we say this process is famously known as opsonization, या in basic terms में हम बोलते हैं this is making the microbes tasty. Tasty means these microbes now have their receptors on the phagocytes where they will easily bind once the IgG and complement has attached. This is famously known as making the microbe tasty so that phagocytes can easily digest them, right? This is known as opsonization or making it tasty. Signal transduction तो बिल्कुल गलत है. Signal transduction, as you know, DNA to mRNA to protein. Phagolysosome fusion is also wrong. That will happen once the phagocytes will digest the microbe. और chemokinesis का मतलब होता है movement towards the chemicals, movement of the बैक्टीरिया और द माइक्रोब्स टुवर्ड्स द केमिकल ट्रिगर्स, राइट, केमिकल स्टिमुलाई. तो वो भी गलत हो जाएगा. ठीक. कीमोकाइनेसिस, मूवमेंट टुवर्ड्स द कीमोटैक्टिक फैक्टर्स. ठीक. चलिए, मूविंग टू 24. प्रेजेंटेशन बाय अ सेल of a foreign antigen bound to a major histocompatibility complex 1 will result in which of the following, right? Think about it. इसका बड़ा सिंपल, easy mnemonic है, याद रखने का तरीका. Generally all of you will be knowing major histocompatibility complex is either 1 or 2, which is present on the surface. So we say the 1 is, yes, the 1 mainly activates CD8 cytotoxic T cells. ठीक है. And the 2 is CD4 helper T cells. Basically हम बोलते हैं कि 2 4s are 8 and 1 into 8 is 8. That means this is number 2. ठीक है. तो 2 into 4 is same as 1 into 8, right? So 2 4s are 8, 1 8s are 8. So what should be the answer? Activation of cytotoxic T cell. ठीक. Naturally, helper T cell will help in the generation of antibodies and they will also activate the further cytotoxic T cells. ठीक. तो helper T cell ये भी करेगा और helper T cell can also help in formation of immunoglobulins, right? Antibodies. Moving to question number 25, the variable and hypervariable regions of immunoglobulins that are responsible for antigen binding and specificity reside in which part of the immunoglobulin molecule? Bataiye. Last question but very easy question. 100% chance of coming in exam. Structure of immunoglobulin karna hai. It can come as a short note in your exams, right? Terminal exam as well as the main prof exam. Yes. What should be the answer? Variable and hypervariable region of immunoglobulins that are responsible for antigen binding and specificity. Please remember, variable, hypervariable regions are present in both heavy and light chains. Hinge में नहीं होता है, ठीक है, ये गलत है. They are present in both heavy and light chains, ठीक है, दोनों में होता है. It is present in both heavy और light chain दोनों में. It is present in both heavy and light chains, right? So these three are false. It is present in both heavy and light chains, right? Variable and hypervariable regions दोनों में होता है, right? Which is responsible for antigen diversity. So the immunoglobulins can bind to different types of antigens, right? Different types of antigens. Yes, this brings us to the end of today's session. So in the next session, we will be doing the, cardiovascular system, right? So I'm telling you so that you can come prepared. I will give you some good questions about from the cardiovascular system. 25 questions again, right? We'll be meeting after 2 weeks and we'll be doing cardiovascular system then, right? Brilliant. So once again, good night, take care, right? And God bless you all.